You planned for connection, for closeness, maybe even a little bit of magic, but instead, you got pain, burning, stinging, soreness, a total mood killer. And now you're lying there like, is this normal? No, but also yes. Because the truth is, you're not the only one who feels pain after sex. And no, it's not in your head, it's not something to be ashamed of. It's your body trying to tell you something. And today, we're listening. This is Sit Here with Teenagers, and we're breaking down the real reasons why pain happens after sex, from dryness infections, roughness, to red flags that say, hey, it's time to see a doctor. And yes, we're also giving you real tools to feel better, because your body deserves more than just pushing through, it deserves peace. Let's talk about the pain no one warned you about. Like this video if your health deserves answers. Subscribe for real talk, real science, and zero shame. No, moisture big problem. Okay, so let's get real. You just finished having sex. Maybe it was passionate, maybe it was quick, maybe it was just meh. But what definitely wasn't part of the plan. That stinging, burning pain down there, you go to the bathroom, you pee, and suddenly it feels like someone lit a fire in your vagina. You Google burning after sex, and now you're spiraling. Is it an STD? Is something broken? Are you just weird? Breathe. The number one suspect here isn't scary, but it is sneaky. It's called vaginal dryness. And no, it's not just for older women. It can affect anyone, even teenagers, young adults, or people in their 20s. Let's break it down. Vaginal dryness happens when your body doesn't produce enough natural lubrication, the moisture that makes everything feel smooth, comfortable, and pain-free during sex. Now, here's the thing. Your vagina is supposed to stay naturally lubricated. It does this thanks to a balance of hormones, especially estrogen. But when that balance is thrown off, your moisture goes MIA, and when moisture disappears, friction takes over. And let me tell you, friction without lubrication is about as fun as sliding down a metal slide in the summer. With bare thighs, dryness doesn't usually just show up like an uninvited guest. It builds, quietly, slowly, and sometimes emotionally. Let me tell you about Jasmine, 19 years old, college freshman. She had been dating her boyfriend for 3 months. They had sex a few times, and every single time she felt pain. But she didn't say anything. She thought, maybe this is just what sex feels like at first. She even read somewhere that your body needs to get used to it. But over time, the discomfort didn't go away. It got worse. Jasmine started feeling dry all the time, even when she wasn't having sex. She felt irritated like she had a paper cut. Sometimes it even hurt to wear tight jeans. Guess what was happening? The stress of moving to a new city, college pressure, and lack of sleep were slowly messing with her hormones, and her body stopped producing enough lubrication. The warning signs were there, but like so many others, she brushed them off. That's the incubation phase. It's when dryness starts creeping in, silently making everything feel just a little off. You ignore it, normalize it, and then one day, bam, pain during sex. Here's how most people describe it. Burning or stinging sensation during or after sex. Pain during penetration. A sharp, dry, tearing feeling. Feeling like your skin is irritated or sensitive down there. A general lack of arousal, even if you're mentally turned on. Light bleeding after sex due to microtears. Discomfort when inserting tampons or menstrual cups. Now here's what it's not. It's not you being bad at sex. It's not you being frigid. And it's definitely not something you just have to deal with. Let's get nerdy for a sec, because understanding your body is power. There are 3 big culprits behind dryness. Think of them as a crime trio. 1. Hormonal changes. This is the biggest one. Estrogen keeps the vaginal walls thick, elastic, and moist. But when estrogen levels drop due to SICU, birth control pills, breastfeeding, extreme weight loss, Eating disorders, perimenopause. Yes, even in your 30s, certain medications like acne meds or antihistamines, the moisture goes to. 2. Mental and emotional stress. Yup, your brain is part of the party. When you're anxious, depressed, or mentally checked out, your body doesn't prioritize arousal. Your nervous system goes into fight or flight, not foreplay. Arousal triggers blood flow to the genitals, which leads to lubrication. But if you're mentally distracted, ashamed, or anxious, that blood flow slows down. 3. Too little foreplay. Rushing. Listen, the vagina is not a vending machine. You don't just insert a coin and expect it to work. It needs time, stimulation, and care. Without foreplay, your body might not have enough time to become fully aroused, and that leads to dryness and pain. Left unchecked, vaginal dryness can turn into chronic discomfort. The vaginal walls may become thinner and more prone to tearing. Microabrasions from friction can lead to infections like yeast or bacterial vaginosis. Worse, you start associating sex with pain. This leads to fear of intimacy avoidance and sometimes vaginismus, a condition where the pelvic floor muscles involuntarily tighten, making penetration impossible. How to fix the dryness. So now that we've diagnosed the villain, how do we fight back? Water-based lubricants. Start here. They're easy, accessible, and instant relief. Look for unscented, pH-balanced formulas. Avoid warming lubes or flavored ones, they can irritate sensitive tissue. Avoid petroleum jelly or coconut oil. They're not pH-friendly and can cause infections. 2. Hydration plus nutrition. Your body needs water. Dehydration, STIs, dryness. Also, omega-3 fatty acids found in fish walnuts. Flax seeds help skin elasticity, including vaginal tissue. 3. Hormonal evaluation. If you're on birth control or meds affecting hormones, talk to your doctor. You might need to adjust or switch prescriptions. 4. Stress management therapy. Journaling. Yoga. Sex isn't just physical, it's deeply emotional. Sometimes your mind needs as much lube as your body. 5. Vaginal moisturizers. These are different from lube. You apply them regularly like a face moisturizer to keep the tissue healthy over time. Look for products with hyaluronic acid or vitamin E. 6. Pelvic floor physical therapy. If your dryness has led to pain and tightness, pelvic floor PT can help. It's not just for older women or people after childbirth. Many young adults benefit from this therapy. Keeping the moisture flowing. 1. Don't rush sex. Get comfortable. Take your time. Communicate. 2. Stay hydrated and eat healthy fats. 3. Manage stress. It affects everything, including your vagina. 4. Avoid douches, scented soaps, and overly aggressive cleaning. 5. See a gynecologist yearly, even if nothing seems wrong. 6. Talk openly with partners about comfort and pleasure. Your body isn't just there to perform, it's there to feel good too. So here we are talking about something that honestly more people should talk about. Because the truth is, infections happen, and they don't mean you're dirty, careless, or broken. They mean you're human. Your vagina isn't a sealed vault. It's a living, breathing part of your body, and sometimes unwanted guests sneak in. Let's break this down the American way. Straight up facts, real-life stories. No shame and a little humor to make it all feel a bit less terrifying. This is the prodromal phase where your body starts giving you little nudges that something's not right, but they're easy to miss or dismiss. Common early symptoms include itching or burning down there even without sex, vaginal discharge that's thicker, clumpier, or smells different, a weird taste or smell during oral sex, feeling like you need to pee more often, slight pelvic discomfort. Real story. Devon, 22, noticed a cottage cheese-like discharge after a weekend away with her boyfriend. She thought it was just sweat from the heat wave. It wasn't. 3 days later, she had full-blown burning and itching. Yeast infection. She waited too long and ended up needing prescription antifungals. Lesson: don't gaslight your own body. If it feels off, trust it. Once the infection takes hold, your body isn't subtle anymore. Here's what different infections can look like. 1. Yeast infection. Candida overgrowth. Thick white discharge. Think ricotta cheese. Intense itching, redness and swelling, burning during sex or urination. 2. Urinary tract infection. UTI. Burning pee, constant urge to urinate even if nothing comes out. Lower abdominal cramping. Cloudy or bloody urine. 3. Bacterial vaginosis. BV, thin grayish-white discharge, strong fishy odor especially after sex, mild itching or burning. 4. Sexually transmitted infections, STIs, chlamydia and gonorrhea. Often silent but may cause pain during sex. Yellowish discharge, pelvic pain. Trichomoniasis. Frothy, green-yellow discharge, bad smell, irritation. Pain plus discharge plus smell. Go see a doctor. Here's where things get serious. If you ignore an infection, yeast infections can lead to skin tears or secondary infections. UTIs can reach your kidneys and cause fever chills and hospitalization. BV increases your risk of getting HIV and other STIs. Chlamydia or gonorrhea can cause pelvic inflammatory disease PID, leading to infertility. Just because you feel fine doesn't mean you are fine. The good news: most of these infections are completely treatable. Let's break it down. 1. Yeast infections. Over-the-counter antifungal creams like Monistat. Oral antifungal pills like fluconazole. Avoid sugar-heavy diets during flare-ups. 2. UTIs. Antibiotics, amoxicillin, nitrofurantoin, etc. Lots of water, flush that system. Cranberry supplements, not juice, may help prevent recurrence. 3. BV. Metronidazole pills or clindamycin gel. Avoid douching or scented products. Treat both partners if symptoms persist. 4. STIs. Antibiotics for most bacterial STIs. Antiviral meds for herpes if needed. Tell your partner, yes, it's awkward, but necessary. Retest in 3 months to make sure it's gone. How to keep infections from crashing your party. Use condoms. They're not just for pregnancy. They block bacteria and viruses too. Pee after sex. Flush out any bacteria before they get comfy. Avoid douching glitter lube and scented products. Your vagina is self-cleaning. Let it do its job. Wear breathable underwear. Cotton is queen. Eat yogurt or take probiotics. Keep that pH balance on point. Get regular checkups. Even if you feel fine, getting an infection doesn't mean you're reckless. It means you're alive, learning and navigating one of the most human experiences, sexuality. Pelvic floor strain. Let's not sugarcoat this. Yes, sex can be passionate, intense, toe-curling, but sometimes it crosses that fine line into, why does it feel like I went 3 rounds with a UFC fighter? This part is all about rough sex, deep thrusting, and the silent hero or victim in your body, the pelvic floor. And trust us, when your pelvic floor starts yelling, you better listen. Here's how pelvic floor strain escalates when ignored. 1. Muscle tightness becomes chronic. At first, the pelvic muscles are just tired, but when you don't allow rest or keep pushing through the pain, those muscles begin to stay tight all the time. It's like clenching your jaw, but in your pelvic region. The result: constant tension, soreness, and pain. 2. Sex becomes fearful. Not fun. Pain during sex leads to anticipation of pain, which leads to more muscle tightening. It becomes a vicious cycle. You want to enjoy it, but your body's in defense mode. 3. Daily activities. Start hurting. Walking, sitting, even peeing. They all start to hurt. Some people develop bladder urgency or feel like they constantly need to go even when their bladder's empty. Many people don't realize that rough or uncomfortable sex can trigger emotional responses, even trauma. When you feel like your body is being used instead of cared for, it can lead to involuntary muscular guarding your body. Literally tightens up to protect you. So what do you do when your pelvic floor is waving the white flag? 1. Rest and recovery. Stop all sexual activity for a few days to weeks. Think of it like a sprained ankle. You don't keep running on it, right? Use warm compresses or take sitz baths. Avoid tight clothing and prolonged sitting. Sleep with a pillow under your knees to relieve pressure. 2. Stretching and breathing exercises. Lie on your back knees bent and take deep belly breaths. Try child's pose, happy baby pose, or legs up the wall. Use gentle pelvic floor drops. Not Kegels. The goal is relaxation, not tightening. Reminder: Kegels aren't always the answer. In fact, they can make things worse if your pelvic floor is already too tight. 3. Pelvic floor physical therapy. This is the gold standard. And yes, it's real. PTs can work with you to release trigger points, retrain your muscles, and help you return to pain-free intimacy. External work, hip alignment, postural support. Internal work, gentle manual release of tight muscles. Education on body mechanics, arousal cycles, and relaxation. 4. Emotional healing. If pain came from unwanted intensity, unspoken discomfort, or past trauma, consider seeing a sex therapist or trauma-informed counselor. Sometimes the body remembers what the mind tries to forget. Prevention. Let's get proactive. 1. Talk before you touch. Set boundaries. Use safe words. Ask your partner, how rough is too rough before you find out the hard way. 2. Use lube, lots of it. Friction is not your friend. Water-based or silicone-based lubricants reduce microtears and make things smoother. 3. Warm up, don't power. Through your body needs to feel safe, aroused, and ready. Foreplay isn't optional, it's protective. 4. Watch positions. Some positions allow for deeper penetration than others. If you feel pain with one, try modifying angles or switching it up. 5. Post-sex care. Aftercare is a thing. A cuddle, a check-in, a warm washcloth, a snack. These help your nervous system calm down and build intimacy. Let's be real for a second. Most of us are terrified of going to the doctor when it comes to anything below the belt. We convince ourselves it's probably fine. It's probably nothing. Just give it a day or two. Maybe drink more water. Google it. Ask Reddit. Hope it magically disappears. But here's the truth. Your body's been trying to tell you. This is not normal, and I need help, and we need to start listening. Because pain that lingers, that repeats, or that just feels wrong isn't being dramatic. It's a red flag, and your job is to recognize it. The early days of many reproductive health issues can feel like a trick. Maybe you feel a little sore, but it goes away. Maybe there's some bleeding after sex, but it stops. Maybe you feel off, but it's not unbearable. So you brush it off. You move on. Because it's subtle. A little dryness. Slight pressure or ache during deep sex. Mild stinging when you pee. Feeling sore but brushing it off as rough sex. Let's walk through some of the most common red flags and why they matter. 1. Bleeding after sex. Not your period. If you're spotting after penetration and it's not your time of the month, your body's waving a flag. Possible causes include cervical irritation, STIs, hormonal imbalances, cervical polyps, precancerous cells in rare cases. Takeaway: one-time spotting, okay, maybe. But if it happens more than once, get checked. 2. Pain that lasts more than 1 to 2. Days mild soreness after a wild night. Sure, normal but persistent, sharp or deep pelvic pain. Days after sex is a different story. Could be pelvic floor muscle strain, UTI, or kidney infection. endometriosis, ovarian cysts, internal bruising or trauma. 3. Fever, chills, nausea. These aren't just a cold. When they follow sex or pelvic pain, they can signal something serious. Pelvic inflammatory disease, PID, kidney infection from a UTI, tubo-ovarian abscess, sepsis in severe cases. 4. Swelling, itching, or strange discharge. This is a big one. Many people dismiss discharge as normal variation. And yes, vaginal discharge does change throughout your cycle, but red flags include thick, white, clumpy discharge yeast, thin, gray, and smelly discharge, BV, yellow or green discharge, STI, pain or itchiness accompanying it. Your body is patient until it's not. When red flags go untreated, things get worse. Stage 1, initial discomfort, mild burning or pressure, slight bleeding, occasional pain. Stage 2, chronic irritation, sex becomes consistently painful. Pelvic floor starts tightening defensively. Libido drops due to fear or stress. Stage 3, systemic spread. Bacteria spreads to uterus fallopian tubes, or bladder. Infections become harder to treat. Long-term damage like infertility or chronic pelvic pain. Real tips for real relief. You've been dealing with post-sex discomfort, maybe even pain. You've asked yourself the awkward questions Googled until your search history looks like a medical file and probably convinced yourself you were dying at least once. Now, here's the good news. There are ways to stop the ouch. And no, it doesn't always involve scary procedures or expensive meds. Sometimes it's as simple as a better lube or better communication. Let's get into real strategies. Real tip number 1. Use water-based lubricant. Not all lube is created equal. If you're using spit or lotion, stop. That's like putting hand sanitizer on a sunburn. Go for water-based lubricants, easy to wash off, body safe. Silicone-based lubes for longer-lasting slip, good for shower sex or longer sessions. Glycerin-free and paraben-free options if you're prone to yeast infections. Do what to avoid. Warming lubes can irritate. Flavored lubes full of sugar. Yeast city. Petroleum jelly baby oil traps bacteria. Real tip number 2. Communicate with your partner. So many people stay silent about pain. Why fear of ruining the moment, James? Not wanting to seem too sensitive. But here's the thing. If your partner isn't invested in your comfort, why are they getting access to your body? Tell them, can we slow down a bit? That angle doesn't feel good. Let's switch. I need a little more warm-up. Let's use some lube this time. Real tip number 3. Avoid scented soaps and douches. Your vagina is self-cleaning. It doesn't need perfume sparkles or pH-slaying foam. Avoid scented soaps or body washes, vaginal wipes with alcohol, douches, they disrupt your natural flora, bubble baths with heavy fragrance. Use warm water only or a gentle pH-balanced cleanser for the vulva, not inside. Real tip, number 4, pee after sex. It seems too simple, right? But peeing after sex can save you a world of hurt. Here's why sex can push bacteria into the urethra. Urinating flushes them out before they multiply into a full-blown UTI. Make it a habit. Go to the bathroom within 15 minutes of finishing. Drink a glass of water if you don't have the urge right away. Real tip number 5. Try a warm compress or sitz bath. After, just like sore muscles after a workout, your pelvic area needs time to recover, especially if sex was long or intense. Use a warm, not hot compress on your lower belly. Sitz bath with Epsom salt, 10 to 15 min soak. Gentle stretching or yoga poses, happy baby child's pose. Real tip number 6. Schedule regular checkups. Even if you feel fine, get checked once a year. Here's what it can help catch early. HPV or cervical changes, ovarian cysts, endometriosis signs, STIs, vaginal infections. A routine pelvic exam or pap smear could mean the difference between a simple treatment or long-term pain. Let's take a moment to look at the bigger picture. Pain after sex isn't random. It's a signal, a call to action. Here's the pattern we've seen over and over again in real lives. 1. Ignored pain. Chronic tension. 2. Chronic tension. Mental stress. Fear of sex. 3. Mental stress. Tightened pelvic floor. 4. Tight pelvic floor. More pain. But here's the reversal. 1. Awareness. Empowered choices. 2. Action. Healing and education. 3. Support. Better relationships. 4. Relief. Return to joyful sex. Let's get one thing straight. Pain after sex doesn't mean your body is broken. It doesn't mean you're doing something wrong. And it definitely doesn't mean you're too sensitive. It means your body is smart. It means it's talking to you. And maybe it's time we all listened a little better. Whether it's dryness, infection, pelvic tension, or something deeper, you are not alone. And you are not overreacting. Talk to your partner. Talk to your doctor. Talk to yourself with kindness. Because pleasure should never come with pain, and healing starts with honesty. So next time your body says, ouch, promise me you won't ignore it. Promise me you'll ask why. And go get the care you deserve. Like this video if you learned something new. Drop a comment. What's your story? Subscribe for more real talk, real health, and zero shame.